You know, health insurance shouldn't be only for the healthy and the wealthy, but that's basically what it is today. Everyone should have a right to health insurance. That's why the health reform bill that we're marking up in our committee under the leadership of Senator Dodd is going to ensure affordable, quality health care for everyone. It's going to put a stop to a gross injustice in our current system, the denial of coverage to persons who have pre-existing conditions. Currently, the private health insurance system openly discriminates against individuals with a history of illness, individuals with conditions like high blood pressure, asthma, diabetes. Currently, insurance companies can openly discriminate against these people. This discrimination is illegal, it's unapologetic, it's also outrageous.
Getting diabetes was out of my control, but being able to treat it shouldn't be. Insurance companies want nothing to do with the likes of me, unless I am willing to fork over all of my salary to pay a monthly premium. I am literally working to stay alive.
Christina told you categorically, she didn't choose to have diabetes 1. She didn't do anything to bring this on. She's like millions of Americans who, from genetic disposition, through whatever their metabolism is, other factors, end up in healthcare crises and problems. And the idea that somehow she's guilty of something and therefore should pay a price for it when it comes to premium costs and others is offensive to millions of Americans. One of the things we've accomplished with this legislation is to eliminate the pre-existing conditions, that healthcare status will not deprive you of the coverage that you ought to be receiving.
For the first time, individuals with pre-existing conditions will be able to pay a fair price for full coverage. We're going to create a system that will actually work for people who are sick.
It is unsustainable that we fail at this. We have no other choice but to get this done and get it right, not only for cost reasons, but for people like Christina that ought to know that there's a health care program in this country that's not going to leave them and their families abandoned to the vagaries of financial ruin. That's not going to happen on our watch.